We're all ready to go. You all know Amanda Ramos. I introduced Tanya. She is our head honcho taking care of things all medical for us, and so we've got a great presentation. A little update from the one we had a couple months ago. So this is being filmed. Be careful what you say out there. It's being recorded. And I'm going to turn it over to Amanda.
Okay. So I think I don't need to use this mic, right? Because Dennis has me all mic'd up like I'm on TV. Can you hear me? Everyone can hear me? Okay, so I'll stand right here. So I know I'm Amanda Ramos. We're in San Jose, Bob. You should be able to say Ramos like a true Spanish speaker, right, Ava? Okay, so wanted to just real quick introduce, I'm the senior analyst in retirement services, specifically dedicated to retiree insurances. So I can't talk to you about your pensions or your COLAs or any of those types of things, but talk to me about anything medical, dental, vision, life insurance, and I can help you. So I wanted to reiterate, Tanya, a star, is Anthem. She's only from Anthem. This is part of the contract with Anthem as a new provider. For the life of our contract, we get to have an Anthem employee sitting in our office here to help retirees, employees. If ever Anthem isn't delivering on, paying a claim, or you're having an issue with a doctor, or, whatever, we have Anthem at our fingertips right here. So that's a real perk. Really nice. And, I know she's already helped a lot of you. She's been invaluable to us. And the beauty is that once she gets all her technology up to date, she's only been with us for like 3 weeks. She's actually going to be able to tap right into the Anthem mainframe of all things claims, and as though she's sitting in an Anthem office. So that's huge for us. And then I have Bessie Olano, who is my right hand, Girl Friday, helps with everything. She's our analyst over health insurance. And then we have a third person on our team, Tammy Lynn Imai, who probably a lot of you have spoken to. She's mainly focused on the transition to Medicare. So when people are turning 65 and have to go get their Medicare cards, Tammy's the person that helps you with that. So that's introductions. I did already do a very big presentation a few months ago about just preparing for change. And so rather than do that same presentation again, because I feel like it's probably a very similar group of people, I pared it way down, and we're just going to kind of go through open enrollment changes. But mostly I wanted to make it about any questions that you guys might have. So this is about a 15-20 minute presentation. It's all stuff you've heard before. It's not going to be anything new. But if you have questions and we can do real live answers, Q&A, that's, I think, the best way to go about it. So did everyone get their open enrollment packet? Everyone got it. We had some issues with the integrity of the information presented on the letters. Some people were listed as having life insurance when they didn't on some of the packets, because each of the packets are customized. If you're in Kaiser, we don't necessarily tell you about Blue Shield going away because you're a Kaiser person. So we customize the letters and tailor the packet to the insurance that you have. So not everybody had the same issues on their letters, but the letter does not mean that we're going to enroll you in anything, or that it means that there's going to be a new deduction from your check. It's just a letter, and if it was incorrect, then line out the incorrection and just ignore it. Okay, with that said, since everybody has their packet, I'm going to assume that you have pink rate sheets and green legal size comparisons in front of you. We'll go through the presentation, but then let's dig into those documents and really answer some questions that might be specific to you. Okay? So objectives for this is to review what's coming in 2020, to make sure everybody is able to interpret the pink rate sheet, because some of those rate sheets got very busy. We know there's a ton of information on these sheets, so if there's anything we want to dive into, just let us know, and then question and answer period. So what is changing and why? We are, of course, keeping Kaiser. Kaiser will still be with us. Sutter Health Plan is not going to be with us. Blue Shield, not going to be with us in 2020. Anthem Blue Cross is a new provider in 2020. Hopefully that message is out there. This isn't new information. Why are we changing? There was a number of reasons. Those of you who are not on Medicare and who live outside of California, you probably know the primary reason why we're changing. The cost of Blue Shield was skyrocketing. Enrollment in the Blue Shield PPO was dwindling. Costs were expanding. There weren't options for people who are out of state. So that was one of the reasons, as well as Sutter Health, which was the only HMO option that was available other than Kaiser. And their service area was very, very limited. They started off in Northern California and were still working their way south. So people out in Almaden Valley of Santa Clara County couldn't have Sutter. So we can't have that. we at least have to have a provider that services all of Santa Clara County. So that was another reason. And right now, 85% of employees and retirees are enrolled in Kaiser. And that's just not a healthy model for ever having competitive health insurance rates. Because when other health insurers look at us as a potential business partner, they say, we can only get 15% of the share. So we're trying to make our organization a little bit more balanced and more healthy in terms of enrollments and offering cost-effective options. Go ahead. Okay, costs are changing. Some very good news that cost went down because the Blue Shield Medicare plans and the Anthem Medicare plans, we actually saw a reduction in premiums for the Medicare options. Some rates went up. The non-Medicare plans did see an increase. Kaiser was about 8% and Anthem is about, I believe, 9% higher than Blue Shield was going to be. If we had stayed with Blue Shield, it was going to be a 30% rate increase. So we dodged a bullet there. Oh, I think I preempted myself here. No, that's fine. So dental. People get dental for free. That's a retiree benefit when you've served for 5 years and you don't defer vest. So as long as you go directly from city service directly into retirement and you worked 5 years, then you're eligible for dental for life at no cost. And that's also continues on to your survivors. So no changes with our dental plans. I'm hoping that in the next few years we'll negotiate a little bit more of a benefit for dental, because we've been at $1,500 per year for a very long time, and cost of living just tells you the dentists are charging more and our $1,500 doesn't go as far as it used to. So there was talk of trying to get implants added in the future. Don't know if that's going to happen. But it's something to look out for. So this year is the end of our dental contract. So next year there could potentially be changes in our dental benefits. Not in cost, but in benefits. Kaiser went up, Anthem Medicare reduced, Anthem non-Medicare increased in rates, just in general. So Anthem, our new provider that we're super excited about. I'm telling you, I have been nothing but pleased with the attention to detail and the resolutions to issues as we bring them up about, information that may be published, and we question it and they say, oh, well, that was an error, we fixed that. So very much interested in making this implementation go smoothly. Here are the plans that they offer. Anthem has, so the first 5 are non-Medicare choices. So they have a $20 Select network, $20 copay. They have a $1,500 deductible Select HMO, a $100 deductible, which is synonymous with a $25 copay. So when the deductible is only $100, it's also known as a copay plan. And then, so 2 of the same types of copay or $100 deductible plans, but different size networks. So when we underline the Select and Classic because that denotes the size of the network of doctors. Select is small selection. Classic is large. And of course, if you can find doctors in the small network, you're going to pay less. But if you have a doctor that you love and they're not in the Select network, the Classic would accommodate you, but you're going to pay more. And then there's the 2 Medicare Advantage plans, the HMO and the PPO. HMO is California only, PPO is nationwide. Okay, so let's explain Select and Classic and what that means. Well, I kind of just did. Select is a smaller network. So I always like to know the why behind things. Select means Anthem has a special contract with this smaller group of doctors, and these doctors have agreed to take maybe lower rates. So this is a group of doctors who are maybe trying to get into the industry, trying to fill their waiting rooms. They want to get more customers, so they're willing to take maybe some lower rates to have Anthem as an insurance that they accept, and they're building their practice. Classic would mean they have a contract with Anthem, but they want higher rates. They want Anthem to pay a little bit more, and therefore you're going to pay a little bit more to be in the Classic network because A, there's more doctors, and B, they put the cost back to Anthem a little bit more. So therefore you're going to absorb a little bit more cost to have that access to care. Yeah, and so Classic plans, Classic networks are a little bit more expensive because you have a bigger selection of doctors. So these are slides from my prior presentation, so you probably know, or these might look familiar. What's an HMO versus a PPO? So Kaiser is the quintessential HMO. You have to stay within this doctor group. You have to see your primary care in an HMO. Your primary care doctor is the traffic cop. They decide if they're going to give you a referral to go to a specialist. You always have to go through your primary care doctor in an HMO. No self-referrals. If you don't like that idea and you want to find your own specialist and you want to not have to go see that primary care doctor every time you want to, have your podiatrist appointment, then the PPO is probably better for you. With the PPO comes a lot of responsibility on you to investigate your doctors, ask your friends who the doctors are that they like, because it's up to you who you go to. So you're making the choices, as opposed to a primary care doctor making the choices for you. PPOs, you do not need a referral. So if you want to go see a dermatologist, you just find a dermatologist and you go see that doctor. You do not have to consult with a primary care in the PPO idea. So of course, more flexibility, more choice on you, that you pay for that. So PPOs generally are higher than HMOs, higher cost to you than an HMO. Okay, so now you're wondering, how do I get the best Anthem plan at the cheapest price? And if you want to throw in without having to change doctors, oh, that's a tough one. So how many of you were Sutter people? Any Sutter people? Okay, so people who were non-Medicare and who had Sutter Health Plus as an insurance provider, in the few years that we had Sutter, people really came to love their Sutter doctors. Sutter was offering us a very low price for their insurance. So the sticker shock for keeping your Sutter doctor when we go to Anthem, it's a huge divide. It's a huge jump because Sutter doctors are Sutter doctors, and now you're asking Anthem, who's a competitor, to pay claims on a Sutter doctor, as well as Sutter was offering us a very low price. So it's kind of a double whammy, and that's where change is expensive. Or not expensive, sorry, change is difficult. If you want to keep your Sutter doctors and you're not on a Medicare plan, then the only option for keeping your Sutter doctors is the most expensive classic PPO, because that's the only plan where Anthem will pay claims for Sutter doctors. Now that does not apply to people on Medicare, because the Medicare plans just operate very differently and are much more flexible. So these lists up here are for the non-Medicare select networks. So in Santa Clara County, you've got SCIPA, Affinity, Physicians Medical Group, Dignity, Alta Bates, Hill Physicians, and the Asian American Medical Group. And that's, I think,
Small version of it.
yeah, oh yeah, this is not an exclusive list, but what I was going to say is these are the big hitters in Santa Clara County, yeah, in San Jose. So you'd be hard pressed to, really the only list that's not up here is Sutter and PAMF. So this is the a pretty exhaustive list of doctors in Santa Clara in the non-Medicare Select network. And hospitals, again, Good Samaritan was not in Sutter's network, but it is in Anthem's network. So that's one of the major reasons that we were happy with Anthem. Okay. I think I covered this point, but I love my Sutter Health Plus doctor. Are they covered in the Select plan? No, they're not. And this is, again, non-Medicare. We'll get to the Medicare discussion. It seems like there's a lot of Medicare folks in the room, so maybe we don't have to go through these details quite. So in order to keep Sutter Health Plus doctors, the classic PPO, the highest price plan, is the only option for you. Medicare Advantage. Has anyone seen or heard that on the TV? Medicare Advantage. Every time I watch TV right now, they are pushing Medicare Advantage plans hard. And I don't know the nuts and bolts behind it, but this seems like a relatively new model for Medicare. So previously, all of the Medicare plans that we had, with the exception of Kaiser, the doctor would bill Medicare first, so Medicare was primary, and then the insurance company was secondary. So Medicare paid the bulk of the bill, the other insurance carrier paid the rest. Okay, so what I think is happening is that CMS and Medicare wants to get out of the claims paying business. I think they are rolling that out, and that's why we're seeing so many of these Medicare Advantage commercials and all these things that you're getting in the mail, is because CMS wants to kind of move out of the claims paying business and start having the insurance companies be the claims payers. Doesn't mean that you can drop your Medicare. You still need your Medicare coverage, but now, like with Kaiser and with Anthem, these Advantage plans mean when you walk into the doctor, you don't give them your Medicare card anymore. You give them your Anthem card, or if you're at Kaiser, you give them your Kaiser card. The bill, only goes to Anthem for payment. So no more Medicare denying a claim or paying and then secondary. You won't get all these bills, evidences of benefits in the mail anymore. It's just going to be claim was submitted to Anthem, claim was paid. So that's the very high level of what a Medicare Advantage plan looks like. They're much more cost effective because the federal government's not involved in all the claims processing. So the cost of having this type of a model, way down. So if you guys looked at your packets, one person to be on the Medicare Anthem HMO is no cost. To be on the Anthem Medicare PPO, $24 for retirees. So that's a huge reduction in monthly premiums for us. Not to mention, you should see no copays on everything. Like $24 is really your exposure per month for one person to be on the Medicare PPO. Okay, I think we're done there. Medicare Advantage PPO. The only question you have to be asking your doctor, you do not have to ask them, do you take Anthem? Do you take Medicare Advantage plans? The only question you have to ask them is, do you take Medicare? If they say yes, then you are assured that they can submit a claim to Anthem on the Medicare PPO, and the claim will be paid. Okay? So if you're seeing doctors who don't accept Medicare, then they're going to be considered an out-of-network doctor. And again, I'm focusing on the PPO because that's the nationwide, it's the plan that we're defaulting retirees into. So for the Medicare, Anthem Medicare Advantage PPO, your doctors will be paid if they are a Medicare doctor. Any questions about that? Because that's, yes?
How did you find out the list of doctors offered by the PPO?
That's what I'm trying to drive home, is there is not a list of doctors, because the only requirement to be an in-network doctor is that they have to accept a Medicare card. You just have to call your doctor and say, do you bill Medicare? Are you a Medicare provider? If they say yes, and some doctors don't want to deal with Medicare. They don't, they're designing their practice to only treat pre-65 people. But most doctors, the majority of people going to the doctor are going to be Medicare age, and I think it's the exception, not the rule, to have a doctor who accepts or who denies Medicare. So the only requirement for seeing a doctor on the Medicare PPO plan is that that doctor accepts Medicare. Therefore, you know that they're going to be treated as an in-network doctor.
I went to my podiatrist and thinking about next year because he's urging that I make an annual appointment, and asked him did he take Anthony Blue Cross, and of course he referred me to his girl up front, and she said, if you have Anthony's Blue Cross PPO, we will have to bill you for the difference.
I think you need to ask your doctor, do they accept Medicare? And if they do, then they need to put the claim in January. We have a special flyer that you can give to your doctor, because this is new for the physicians groups as well, this Medicare Advantage idea. That whole perception that they have to be a carrier that has, a contract with the insurance company. They don't have to be an Anthem provider. They don't have to accept Anthem to be able to submit a claim on your behalf when you're on the Advantage plan. Does that make sense to you? You kind of have to undo your idea of them being an Anthem provider, because in the Medicare Advantage plan, they don't have to be an Anthem provider. They only have to have the ability to bill Medicare. Okay? If we can help with that, we have a flyer. You can also call Anthem's Tanya. Yes, Gwen.
Amanda, if you're only showing them your Anthem card, they're quite likely to say, no, we don't do that. But the Medicare is who they're going to bill. If you're going to show them a card they don't serve.
These cards look different. They have different numbers on them, phone numbers for contact. You know how when you go to the doctor and they say, let me call your insurance and confirm eligibility. When they call that Anthem number, the rep is going to be able to explain how to submit a bill to a Medicare Advantage plan. It's a very different model, not one that you should have to worry about. Eventually, My thought is, when 4,000 retirees at the City of San Jose are going to this plan, the doctor's offices in our local area are going to get familiar with this plan. We're not the only people in the county who have it.
It's been around for about 2-3 years.
Right, it's just new to us.
Yeah. The doctors are pretty familiar with Medicare Advantage. Medicare Advantage.
Yes, and that's the key. Medicare Advantage is Advantage actually is like an industry standard word. It's not just an adjective for being great. You know, that's why you're seeing it all over the TV. So to that note, on the TV and all the stuff that's coming into your mailbox right now, it's open enrollment for Medicare. Don't read all that stuff. Just read City of San Jose stuff, because you have all the insurance that you need through the city. Most people out in the world don't have a nice pension plan that has insurance for them, so they need to read those flyers and listen to those commercials. But you guys are the exception. You already have insurance being offered to you. You don't have to go buy more, especially the Part D. Do not fall for that. Sorry. Yes.
We are being bombarded by Pam. We've been going to,
Repeat the question. Sorry.
66 years. I don't want to change my doctor. So if they've been accepting my previous Medicare, is there going to be an issue with getting off that Pam, Palo Alto Medical Foundation accepting?
Okay, so Dennis has made me promise to repeat all the questions. So I'm going to summarize your question. She's been using Sutter and PAMF doctors exclusively under the Blue Shield plan. She wants to know, is there going to be an issue? No, because of what I just said. If you go to the Medicare PPO plan, your existing doctors on Blue Shield Medicare plans have been taking Medicare, right? So they already met the first criteria of being able to bill Anthem.
So we can ignore all the emails we're getting about all these days to go meet with people at Pam.
Right.
Medicare advice.
Yes. Yes. Let me just tell you, everybody sells those mailing lists. A lot of the stuff you're getting is generic. They're not talking to you about PAMF because you've been in PAMF. They're just hoping they'll get a sale on an insurance policy. So really, you got to follow the money. They solicit you with all that mail because they're hoping you'll switch over to their insurance coverage. Yes, Joe.
Are there any changes in the coverage for prescription?
Are there any changes in the coverage for prescription? Boy, I'm not a super expert in this, but I want to say we contracted with Anthem, and the criteria was to quote us the identical plan that we had before. Every insurance, correct me if I'm wrong, every insurance company has a formulary list, and Blue Shield's formulary list is different than Kaiser's formulary list is different than Anthem's. And I think that's because they kind of work deals with, not deals, but have different rates with the prescription drug providers. And so Kaiser's cost for Jardiance is going to be different than Blue Shield's cost is going to, so each provider has a slightly different list of things that are going to be generic or low cost. However, co-pays are the same, right? If you're getting generic medication, the copay from Blue Shield is going to be the same copay that you have today. Specialty drugs are, you definitely want to contact Anthem if you have a specialty drug, and talk to Anthem about that. But in general, it should be very similar to what you had with Blue Shield.
So does it incorporate Part D of Medicare?
Good question. Okay, so Part D, let's talk Part D. When you have a Medicare card, you're entitled to prescription benefits, right? Through Medicare is going to help subsidize your prescription drug costs. However, you kind of need to decide who you're going to use those benefits with. So when you enroll in a City of San Jose Medicare plan, you are saying, and by signing up, you're agreeing to all of my Medicare benefits are assigned to Anthem. You cannot take your Medicare card and go use it somewhere else at a pharmacy and expect that Medicare is going to cover the cost of a prescription, because no longer are we going to be in that billing Medicare model. Everything has to be run through Anthem. Now, some people have, well, I don't know her name, but I've spoken to somebody a lot on the phone. She got hooked into buying a Medicare Part D plan. Then she tried to use her Blue Shield prescription card at CVS, and they said, Blue Shield's not going to pay this claim. Why is that? She goes, I have so much insurance for prescription drug. Why aren't they paying it? Well, they say you have a Part D plan. So there is such a thing as too much insurance, especially with Part D. You do not need to buy a Part D plan. Your Part D benefits are all embedded in your Anthem plan. So you don't need anything additional. You are assigning, that's an important term, assigning your Medicare benefits to Anthem, meaning I have this insurance coverage, but I'm going to give it over to Anthem because Anthem's going to cover everything. Does that answer your question?
Pretty much.
Okay, good. Yes.
Is that also true with Kaiser? Because I'm going to join the part of Medicare starting in July, so is that the same?
So the question is that true with Kaiser as well? Yes, it is. That's why when you transition, when you come to our office and you say, I got a Medicare card, we have a 5-page form that you're going to sign for Kaiser. And one of the things that you're signing is, I'm assigning my Part D benefits over to Kaiser. Yes, same exact idea. Yes.
So I just wanted to clarify this. So myself, right now I have PPO Blue Shield that's going to be out. So now it'll just automatically transfer to Anthem. And now I have Medicare. So this Medicare Advantage, is that going to apply to me, or do I have to do something?
Okay, so the question is, she has Blue Shield right now, and in your Blue Shield, your open enrollment packet, Mike, I have a question back for you. When do you turn 65 and when does Medicare take effect?
I turned 65, so it's already
Okay.
in transition.
So in your letters for open enrollment, we listed what your default plan would be. So Retirement Services always tries to make it easy at open enrollment that you do not have to submit forms unless you are wanting to change. So if we don't hear from you, we take that to mean you're happy with what you have and you accept the new rates for next year and you want to stay where you are. However, since this year we have Blue Shield is going away, in your letter, but your letter went out probably before you were 65, right? Is that what? Yeah, so your letter probably says one thing about not being in Medicare, but subsequently you've gone to Medicare. So this does apply to you. We would automatically roll, Blue Shield Medicare people are automatically going to roll into the Medicare Advantage PPO with Anthem. You don't have to do anything. No news is good news. If we don't hear from you, you're in the Medicare Advantage PPO. The only reason we need to hear from you is if you want to change your dental, change your vision, or you don't want to go to the Medicare Advantage PPO. Any other questions? Yeah.
Mine's on life insurance.
Oh, okay. Life insurance.
My letter did say I have the life insurance, which
You don't?
I don't.
Okay.
Well, I don't know. I can't remember back 6 years ago when I signed all those papers. I signed up.
Oh, to be a retiree.
But it does say I will be paying $9.60.
Which, okay, so his question is about the letter and the information in your letter. If you look at your pay stub today and it says standard life, then in 2020, your standard life rates are going up, I believe it's like 10 cents per 1,000 of coverage. So if you have 10,000 in coverage, it's going up $1. Some people have 25, so theirs is going up a couple dollars. But if you don't have it today, you're not going to We're not going to enroll you in life insurance.
Okay, so they're saying now I'm paying 0. Does that mean I don't have it?
We would have to look at your paycheck stub.
Okay, so I
That
need-
was the issue with the letters, is we somehow got off on our lines and people were told they had life insurance when they didn't. And then probably the people who do have life insurance were told that they didn't have life insurance. So call our office if you have questions or look at your paycheck stub. Yes?
Yes, regarding Anthem California only and Anthem nationwide, can you explain the difference, please? And then there's in-network and out-of-network.
Are you on the Medicare? So the question is the labels of Anthem California only and Anthem nationwide. California only means that you have to be a California resident to be eligible to take that coverage. If you don't live in California, you cannot enroll in that coverage. So the nationwide label implies anywhere in the nation you can take it. So you can be in California and have that, or you could be in Oregon, or you could be in New York and you could take that, the nationwide insurance.
As far as coverage-wise, if we have California only, but we're traveling or whatever, it still covers.
Good question. If you have the California only plan and you're traveling, what do you have? So Tanya, maybe you could help. I know that the with the HMO, which is the California, and are you, well, we'll describe Medicare and non-Medicare because it's kind of two different answers. You can talk into that.
So with the HMO California only plan, when you travel outside of California and you have to go to the emergency room or it's an urgent care visit, we cover that only. But that's it, just emergency services only outside of California.
Isn't there a traveling or like a student?
That's the HMO.
Yes, okay, so that's what I was talking
If you have a student that's in college in another state, then we cover them as well.
Okay. So I can add to that a little bit.
Okay.
So of course when you're traveling on any plan, Kaiser, Anthem, if you're traveling somewhere and you have an emergency, they're going to pay you back for that care. However, you can't, like an earache, let's say you have an ear infection. That's not an emergency. So if I know they're painful, but that's not worthy of an emergency room visit. So they would not reimburse you if you went to an ER for something that is like routine type care. However, when you have the HMO and it's California only, but you have students who go out of state for college, I know that I've seen a traveling flyer. So there is your son or daughter who, or even your spouse, let's say they're in a master's program or something, if they go to another state, there is kind of a reciprocal HMO where they can find a primary care in their area, and Anthem will, of course, cover them for routine care. Because when you're a student, you're not necessarily traveling, you're there permanently.
Right.
Right?
Right.
Okay. Oh, yes, Dennis.
Did that change at all with the PPO for international travel?
International travel. So international travel, I believe, is the same thing.
So with the international travel, you have to pay them, of course, before you leave. They won't let you leave without paying, and they won't fill a U.S. plan. So you've got to pay them up front, get an itemized statement from them with what they did, what services they performed, your diagnosis, bring it back to U.S. and file a claim with Anthem.
Right.
So get reimbursed.
I'll say that into the microphone. You have to pay up front for international care. And of course, it would have to be emergency care, not the same thing. You break your leg in Italy, you definitely get the care, you pay for the care, bring your receipt back, and Anthem will reimburse. Yes?
A two-part question. It has to do with drugs. I'm under Medicare, PPO, Blue Shield, been very satisfied. I use the 90-day prescriptions by mail. How is that going to be set up? And the second part of my question is, sometimes if I go to a doctor, and unfortunately we all got to go to the doctor all the time, but when I go to a doctor and he says, I want you to use this say it's for 2-week prescription, I can go to the local drugstore and get that filled immediately on my way home. How is this gonna work when I get a prescription from my doctor? It's a new one. And the first part of my question was, how is the mail order prescriptions gonna work? And the second part is, what about when I get ones for just, take these pills until you've used them
Yes.
up?
Okay, so the question is, how does Anthem's mail order prescriptions work the same as Blue Shield's? And what if you don't need a 90-day supply, you just need a short-term 2-week prescription for an ointment or something that's not 90 days? So Anthem has a mail order service, exactly. You're not going to send it to the same place. It's a different one than Blue Shield, but same benefits, 3-month supply for a 2-month cost. And the regular, ointment type prescription, it's the same. There are pharmacies, you go in, you use your Anthem card. Does that answer your question? It's the same, you'll have a copay. You'll just have a copay for the ointment type. Yes. Mm-hmm. One thing I want to spread the word on, Blue Shield is going to provide Anthem with all active prescription files. So obviously Blue Shield knows if you have a refill left on your current RX. I advise all of you, before we switch over to Anthem, to talk to your pharmacist and say, do I have open refills? Do you need authorizations from my doctor for my refills? Just get everything up to date before we make this switch over. Because if it's all up to date and open and approved and you still have refills left, there will hopefully, fingers are crossed, be no hiccups for you, and you could walk into the pharmacist on January when it's Anthem 2020 and your prescription is still sitting there ready to be filled. Question?
2 questions, actually. I take specialty drugs,
Mm-hmm.
and that had to have a prior authorization.
Mm-hmm.
Will that carry over, or do I need to ask for authorization all over again? And secondly, are you saying that from now on, instead of showing our Medicare card and both maybe our prescription Blue Shield and our 3 cards, we only have to show
Yes.
one Anthem?
Okay, let me repeat your questions. For specialty drugs or drugs that doctors only write for a 30-day prescription, those are not going to carry over. You may need to visit your doctor and get Anthem up to speed with your current prescriptions. Because if your current prescription is only good for 30 days and you get it filled in December, you're going to have to start over again in January with Anthem. And the second part of her question was, am I saying that we only have to give the pharmacist an Anthem card? Yes, 1 card. No more Medicare. Don't throw your Medicare card away. Keep your Medicare card. You can get rid of your Blue Shield cards, another thing with Blue Shield was if you're a husband-wife team or domestic partner, it was only under the retiree's name, and I can't tell you how many phone calls we fielded about that. Not being able to tell whose card is whose and which one's a prescription card and which one's... Anthem is 1 card, and you'll just give the pharmacist that card in January.
So to clarify that, on January 1st, if we have specialty drugs, we should go into our pharmacy that day and start the process, giving them the new Anthem number.
Yes.
Which the process, I believe the process behind the scenes is to call your doctor. And so if you're switching doctors, you may need to make a doctor's appointment to get your specialty prescription filled. Probably not an issue for the Medicare folks, but if you're a Sutter and you're in the commercial plan and you're not keeping your Sutter doctor, you may want to make sure you have an appointment scheduled as soon as you can in January so that you can get your prescription. Although Anthem can help you with that. I know that there is a service for making sure if it's, life critical medication, they can get you in to see somebody or help get that approval transferred over. Yes?
I have a Silver Sneakers question.
Okay.
Currently, Blue Cross covers almost 24-hour fitness facilities. Will Blue Shield be covering more facilities?
I think you said those backwards. We have Blue Shield right now, but I know your question. Blue Shield only covers 24-hour on their Medicare gym, free gym service. Is that the same with Anthem?
We still use Silver Sneakers as well, so we're just...
The same.
You have to call them, Silver Sneakers, again, and tell them you have new insurance as of January, which is Anthem.
Her question was, is it more than...
There's a website for Silver Sneakers. It's listed all in there. Yeah, it's all on there.
Let me repeat all of that for the microphones, for the folks on YouTube. Silver Sneakers is not specific, like the gym list is not specific to the insurance carrier. Silver Sneakers is kind of its own program. So I think you're going to probably see the same gyms that you saw under Blue Shield, because Silver Sneakers is the program, not Anthem or Blue Shield. Does that make sense? You don't like the answer. Any other questions? Yes. I'm sorry, I can't.
So I probably should contact my lung doctor to advise him, like get clearance for the switch over and
I think you're probably going to want to contact Anthem and ask specific questions about your care. Okay.
Repeat the question, please.
It was about her specialty doctor and a particular medical issue that she has. So I think you're better served talking individually to Tanya and about your care and your providers. I will say, and this was in your cover letter, if you're in the middle of care right now and you're concerned about continuity of care, not things like, I go and have my thyroid tested every week, but if you're in the middle of chemotherapy or, a very serious medical care that cannot be interrupted, there are care workers, case workers to help with the transition. Certainly, if you're able to keep your same doctors, then there's not going to be any interruption to your care. But if this new change means that you have to change doctors, which we know there are people that are out there that have to switch doctors, and I know it's very difficult, but we want you to know that there are services and care teams available to make sure that you're not without care and that claims are not an issue and that, it's an easy transition. Yes?
Is there a vision or hearing coverage with Blue Cross?
So with the Medicare Anthem plans, there is hearing aid, up to $500 towards hearing aids annually. Vision, no. However, they will pay for an eye exam, but when we talk about vision, to me that means glasses and contacts, and they will pay for you to get an eye exam from your doctor, the chart on the wall. But if you're going to go have the optometrist do all the, for your prescription, that's not covered. Yes?
Did I understand you to say that there's going to be a flyer about the Medicare Advantage plans that we can give to our providers?
Yes. Yes, we have one on the table up here. It's called the National Access PPO. It's on the retirement website. It's on the Anthem City microsite. I believe it was in your open enrollment packet. I thought we put that in all Medicare open enrollment packets. It has a little perforation at the bottom, and it says, yes, that one. It was color, just a single sheet. So the question was for the cameras, is there a flyer that we could give to our doctor for making sure that they bill Anthem? And yes, there is a flyer. It's on every website. It's called the National Access PPO. It's on the retirement website, the Anthem website, Anthem can email it to you. Retirement Services can email it to you. Any other questions? Yay. Oh, one more.
Related to the question about your really going to do a pre-authorization. Also, Kaiser, about that. So what I'm interested in is there a relationship between Medicare and the Advantage plan as far as the policy of what they really have to authorize on things like preventative diagnostics?
Absolutely. There is a summary of benefits document out on our website as well as on the Anthem website. If you have your green sheet, and I go like this because it was like a legal size sheet in your packet, on all of the Anthem plans at the very top square, I wish I had made it giant, is a web address. And that is a web address for a city-specific Anthem website. So you're only going to see city plans and city information, not, Anthem National. As far as, so you're transitioning from Kaiser to an Anthem Medicare plan. If you're going to the PPO, you don't need prior authorizations for anything because it's a PPO. You're in charge of your care, and you can pick specialists and go to any doctor you want.
Well, there's a list here of potentially that they might decline as voluntary preventive disease.
What are you looking at? I'm sorry.
It's on the back of it that says questions about prior authorization on the back. In blue or turquoise. They say the recommended authorization for acute care, endoscopies, insulin, CT scans, MRI.
Okay, so I guess your question is about prior authorization for billing versus a referral from a doctor. So prior authorization for sure, you want to make sure, personal experience here, doctors will schedule surgeries at surgery centers, and they're not thinking about whether your insurance takes it or not. So you definitely want to make sure when you're scheduled in facilities for services like endoscopies or colonoscopies, the center has to take Medicare. Because remember, for the Medicare PPO, the only requirement for being covered is that it takes Medicare. If the surgery center that this doctor referred you to, or where they do their procedures, if the surgery center is not a center that takes Medicare, then very possibly Anthem's not going to cover the surgery center costs. So highly, that's a very good point, and I highly recommend when you're going to outpatient surgery center type things, you want to make sure the facility has prior authorization for your event. Yes.
I think there's still some issues even with local hospitals that the surgeon or other physician there may not be, and you might get a separate bill.
Yes.
And I think there's some state legislation that's...
Who are the anesthesiologists? They're the notorious ones. They're kind of rogue, and they kind of are independent, and they travel from hospital to hospital. And so they may be the person on staff doing your surgery or your care, but they may not be prior authorized through your insurance, which is more than you should have to worry about when you're getting But I will say I've been through that as well personally, and eventually they all agree to honor your insurance. They put you through a rigmarole and a few denials, and then eventually they'll pay. So, and that's where we can come in handy, as well as Tanya. If you're getting denials for like ambulance services or anesthesiologists, things like that, they're just hoping you'll pay. But we'll make them play nice and bill your Anthem. They just don't like to bill. Yes?
I've sort of been watching to see whether Tanya was putting something with a perforated section on the table, and I haven't really seen that. Did you find that thing?
Oh, you know what? I will give it to Sue and she can post it, or we can email it out to all of you. Yeah. It's the same information that's going to be on the back of your card. It's just something for you to say, see, I have proof from Anthem that they will pay your claim. Yes?
Could you repeat your name?
My name is Amanda Ramos. And 794-1000 Retirement Services. And anything else? Yes.
When will these cards be coming in the mail?
Your cards should be coming the end of December. It's everybody's intent that you have them on January 1, the day your insurance starts. However, experience tells me that is a very tough time to get everything done and mailed and in your hands by January 1, which is a holiday. So we are acknowledging every open enrollment form and making sure that there are phone numbers published on all of your documents, so that should you need to see a doctor January 1 and you don't have your Anthem card yet, you can call Anthem and get your number. So that doctors are familiar with this. This is not their first time of January 1 and people don't have their cards. They'll take a subscriber number. So we can definitely get you the numbers if you don't have the actual card. Yes?
Just to clarify, those of us that have no changes, do we have to do anything?
If you have no changes, you do nothing. However, everyone in Blue Shield has a change, but you don't have to turn paperwork in. Oh, in lieu, yes. Sorry, in lieu. The retirement plan acknowledged a few years ago, 2 years ago, that if you are not enrolling in the retirement medical, that they will give you a little something. They won't give you cash, but they'll give you credits, and they're called in lieu credits. If you were in the in lieu program last year, the municipal code unfortunately says you have to re-sign up every year. So that's the exception to the question about if I want to keep everything the same, I have to do nothing. Yes, for 99% of you, but if you're in the in lieu and you want to keep the in lieu, then you have to give us a form telling us you want to keep the in lieu.
And you use the same form that's for changes, you just mark no change and sign it.
And check the in lieu box, but we can figure that out too. Yes. Just check the box and sign the form and we keep you where you are. The in lieu credits went up slightly. Every time the plan cost goes up, the in lieu credits, because they're a portion of the plan cost. Okay, Rorge, did we get everything and everybody? Yes, one more?
As far as life insurance, if we switch from Kaiser to Anthem, will that cover big carry-on life insurance?
Life insurance is not associated with Kaiser or Anthem. Life insurance is standard life insurance. Is that what you meant?
Right.
Yeah. So his question was, will life insurance change if you change your medical? No. Life insurance is different than medical, and we won't touch your life insurance unless you tell us to cancel it.
So we could increase it or decrease it?
Nope. All you can do is cancel it. Keep it or cancel. Those are your choices. Bob. Or you could die and collect, says Bob.
I got erased off the tape.
I think we're done, and we thank you, and we want you to know we're here for you. Our jobs exist because of you guys, so we're here for you. Okay?